I hate to say it, but it feels like 2020 all over again. Overcrowded hospitals and thousands of individuals exhibiting flu-like symptoms. China is experiencing a new health crisis, a disease outbreak that resembles the Wuhan virus. Beijing, as usual, refuses to share any information. They refer to it as pneumonia of unknown origin. This is how Chinese authorities have described it. Beijing claims to have built up systems to monitor the spread. If you feel like you've heard this before, you're from the same China as 4 years ago. They're making it sound like it's only flu season. We hope it's just that, but the pictures reveal a different story. Take a look at it. This is thought to be from a hospital in China. We can't authenticate these images, but other videos like this one are circulating viral. Clearly, there is more to this story. We don't want to speculate and exacerbate the panic, but here's what we know thus far. This isn't a novel disease. According to experts, China is seeing an outbreak of the human metapneumovirus, HMPV. This virus has existed for at least 60 years. It is quite common and easy to catch. So unlike the Wuhan virus, they appear to be dealing with a known disease. Nonetheless, there are legitimate concerns. The first factor is the extent of the outbreak. It's huge. Cases have been reported in several cities across China. They are the most vulnerable to catching this virus, and many of the current victims are young. Furthermore, treatment is difficult because, like the Wuhan virus, HMPV is a respiratory disease. There is no medicine to cure it, and no vaccinations exist. The symptoms are similar, including fever, coughing, and shortness of breath. This is what HMPV patients have. In severe situations, they may develop further issues such as bronchitis or pneumonia, necessitating urgent care, oxygen, or possibly a ventilator. Again, does this ring sound similar to you? We've all seen what happens when hospitals are overburdened, when there are too many patients to treat and not enough resources, when oxygen supplies are close to run out, when patients can't get beds for treatment. HMPV is not the same as the Wuhan virus, yet it can still cause havoc on the health system. China is also aware of this. In reality, its hospitals are already seeing the strain. Despite this, it refuses to disclose the nature or scope of the outbreak. It appears to have learned nothing from the previous pandemic. It stays in denial. Simply look at this article. It came out 3 days ago. The World Health Organization, WHO, sent an appeal to Beijing. It has asked China to be transparent about the Wuhan virus pandemic. The WHO requested data from Beijing. And how did Beijing respond? With denial. On the question of COVID-19 traceability, China has always maintained a spirit of scientific openness and transparency, actively supporting participation in global scientific traceability methodologies. At the same time, we strongly condemn all forms of political manipulation. China's openness and transparency have surpassed expectations. In recent times, China's handling of public health crises has been under global scrutiny. While Chinese authorities often claim to have exceeded expectations, the World Health Organization's, WHO, perspective on this matter has notably evolved. A stark example of this shift can be traced back to 2023, when a WHO official openly criticized China for its lack of data transparency. The official remarked, "China's lack of data disclosure is simply inexcusable," highlighting a growing frustration within the international health community over China's approach to managing and reporting health crises. Moving forward, the global community must prioritize transparency, cooperation, and swift data sharing to prevent future health crises, ensuring nations are held accountable in safeguarding global health.